I'm entering the room. I'm checking for scene safety. I'm ensuring that there is no loose cords on the floor. There is no wet floor. The scene is safe for me to enter. I'm doing hand washing according to WHO guideline. So it is palm to palm. Right palm over the door smoke, left palm, and vice versa. Fingers interlaced, fingers interlocked, and vice versa. Rotational rubbing of the tip of thumb, and rotational rubbing of the thumb of other hand, rotational rubbing of the tip of the fingers, and vice versa, rotational rubbing of the wrists of both hands. Hi, my name is Mimi. I'm one of the registered nurses working in this facility. So can I have your name, please?
Ashley Brown, 19 December 1995.
Can I check the same with your ID band, please?
Yes.
Okay, so your name is Ashley Brown and your date of birth is 19th of December 1995. Okay, fine. So do you have any allergies?
No.
Okay. So are you in any sort of pain now?
No.
Okay. Are you comfortable now?
Yes.
Okay. So I'm going to take your observations, that is your blood pressure, oxygen saturation, pulse rate, respiratory rate and temperature. Is that okay for you?
Yes.
Alright. Is it okay if I come back with the observations machines?
Yes.
Okay. I forgot to ask you one thing. The procedure is going to take 15 minutes and do you want to use the washroom now?
No.
Okay. Thank you.
Assume that I have come back with the equipments and the equipments are clean and calibrated.
So I'm hand rubbing according to WHO policy and so I'm going to take your blood pressure now. Is that okay for you?
Yes.
Shall I use your left hand to take your blood pressure?
Yes.
Okay. So I'm ensuring that there is no lesions, infections, inflammations, IV cannulas on that hand. Have you had any surgeries on that hand?
No.
Okay. So I'm applying the blood pressure cuff on the hand and before that I'm ensuring the cuff is of right size, that is 80% of arm circumference by its length and 30% of arm circumference by its width. So and I'm locating the antecubital fossa and I'm applying it 2 fingers above the antecubital fossa. So you will be feeling a pressure sensation while I am taking the blood pressure of that hand. That is completely normal. Okay?
Yeah.
So I'm going to take your oxygen saturation on your other hand. And is that okay for you?
Yes.
Yeah. So I'm checking your fingernails for any nail varnish, any fake nails. And I'm checking whether it is warm, not cool. And I'm also checking the capillary refill by pressing the tip of the nail for 5 seconds. And I have seen that the capillary refill is less than 2 seconds. So it is safe for me to put the oxygen saturation probe on that hand. Is that okay for you?
Yes.
So I'm placing the oxygen saturation probe on this hand. So your blood pressure is 125/85 and your oxygen saturation is 95. Both are completely normal. Let me chart it.
Okay.
So I'm writing the name, I'm writing the date of birth of the patient and I'm putting the date, I'm putting the time, and I'm writing the oxygen saturation as I get the value. It is normal. Blood pressure So I'm hand rubbing according to WHO policy, and I'm removing the cuff and saturation probe. Is it okay if I check your temperature from your ear?
Okay.
So I'm checking the ear for any drainage, any pus, so it is clear. So is it okay if I pop this temperature probe inside your ear?
Okay.
Okay, I'm discarding the cap into the clinical waste. Okay, your temperature is 37, which is completely normal. Is it okay if I chart it?
Okay.
Thank you. I'm hand rubbing according to WHO policy, and now I'm going to check your pulse rate for 2 minutes. Is that okay for you?
Yes.
Thank you. Starting now. So your pulse rate is 88, which is normal, and your respiratory rate is 20, which is also normal. And I didn't tell you that I was taking your respiratory rate because it can alter the value. Is that okay for you?
Yes, it's okay.
Thank you. Let me chart it. So the patient is not on any oxygen, so I will be writing air for that column, like an A, and the patient was talking to me, so he is alert. I will put an A in that column as well. So now I will chart his NEWS score, and I've got a NEWS score of 0, and for 0 the monitoring frequency will be 12th hourly, and escalation of care is not required, and I will sign it. Hi, I've got your NEWS score and it is 0, which means I will be coming back to you to take the observations every 12th hourly. Is that okay for you?
Yeah.
Okay, thank you. So is it okay if I ask few more questions to you?
Yes, of course.
Okay, so can you tell what brings you here to the hospital?
Respiratory distress?
Okay, have you slept well yesterday?
Yes.
Alright. How is your bowel pattern? Is it normal?
Normal. I'm very regular.
Okay, so are you eating well?
Yes.
Alright. Is there anything which I can do for you?
Nothing. I'm all good. Thank you.
Alright. Okay, thank you for your cooperation. So I will be removing all the aprons, and I will be discarding the gloves, the clinical waste, and I will be doing hand washing, and I will take the equipments with me, and I will make sure it is clean and ready for the next use. Thank you.
I'll provide the call bill as well.